was moved from Dallas to Emory University in Atlanta, where she will begin her treatment this morning, continue her treatment here this morning. But she was moved on the very day that much bigger questions are now being raised about just how well prepared these healthcare workers that treated Thomas Eric Duncan, the first patient that died of Ebola last week here at Texas Health Presbyterian Hospital in Dallas. A prominent nurses union, a national union, saying that the healthcare team was simply not given the proper protocols, not prepared to handle the situation into which they were entering. A lot of questions about the protective gear that they were wearing and whether or not that could have been a failure in that area is what led to their infection. CDC investigators say they're really concentrating on the first 2 or 3 days that Thomas Eric Duncan was brought here to the hospital, where at sometimes the healthcare workers were wearing 3 or 4 layers of protective gear, and in some cases had skin that was exposed. So that's one of the areas they're focusing on. The hospital officials have not commented directly on these allegations, only have said that the safety and care of their employees is a top priority. Christine and John?
All right, Evan and Dara, thanks for that. Now, Amber Vincent's flight from Ohio to Texas is sparking Ebola fear in both states. 2 schools in Belton, Texas are closing today because a pair of students flew on the same flight as Vincent. In suburban Cleveland, 2 schools in the Solon school district also closed today because a staff member traveled from Dallas home to Ohio on a different flight than Vincent, but, quote, perhaps the same aircraft. Schools in both districts will be cleaned and disinfected.
Look, I do understand why people are concerned, but I think medical experts will tell you this is an
They'll say there's zero
overabundance
risk.
of caution there. Those measures not necessary.
On Capitol Hill later this morning,